Thank you so much for the kind introduction, Dr. Amrita. Good afternoon, everyone. And we are at the fag end of this wonderful conference. Thank you so much for the organizers for the opportunity. So when Dr. Bhatt approached me to speak in this conference about adolescents, acne was a natural choice. But I take this opportunity, these 15 minutes that have been given to me, to sensitize you guys to when to refer to us. Right? You would not put Invisalign yourself. You would refer to Dr. Ramatri. So in that way, why would you prescribe a topical to a child? I mean, a primary treatment is fine, but why beyond that? But why is a pediatrician pivotal? You guys are the first points of contact of so many. You are the trusted players in a child's health journey. So, yes, that's where you come in. Now, I'm not going to be too theoretical here. I'm going to, in the etiopathogenesis and all, how would you explain to a child, right, an adolescent? So what is acne? So it's a chronic inflammatory condition of the pilosebaceous unit. So we tell them that your hair follicles and your oil glands, they're all mixed up together. And as you grow older, as your hormones come into the picture, seborrhea, that is oiliness increases, which clogs the pores, which we call comedones, which eventually gives rise to inflammation. Now, the population is scant, but can I have a show of hands? कि इधर बैठे किस को आज तक pimples हुए हैं? Right? That's an overwhelming majority, right? It's apparently the 8th most common disease worldwide, if we choose to call it a disease. It affects a good number of the global population. And though we call it a condition of adolescence, there is pre-adolescent, post-adolescent, adult inflammatory, heck, there is even post-menopausal acne. Okay, there's no escaping acne. And a lot of cases of adolescent acne do progress into adulthood. And in these severe cases especially, family history is often positive. The etiopathogenesis, to make it simple for a child, it would be like as you're growing older, your hormones increase, whether you're a boy or a girl, and your lifestyle plays a big part in contributing to the excessive oiliness. Now this oil production then works along with dead skin that goes and clogs your pores and causes what is called comedones. Now these children that we are speaking about, these are all digital natives. We are digital migrants. We've lived a life before social media and this entire internet revolution happened, right? But they have been born into it. And where do they source their information? So there can be a 12-year-old who comes and tells me, Auntie, I think I've got comedones. Auntie, I think I want to start Tret. Okay. The parent is clueless. The parent is like, Anakaink samjhao. Okay, so in their words, we like, it's oiliness, it's clogging your pores, and you yourself are contributing to it by your lifestyle. This is what we are going to come to next. Now, Cutibacterium acnes is the new name for Propionobacterium acnes. Now, this is the key organism here, right? And there is an inflammatory response. Role of diet and sleep cannot be emphasized enough. And as with everything else, with this generation, if we speak their internet influencer buzzwords, they're more likely to believe what we say, right? So their favorite influencer is talking about gut health. We speak about gut health. Okay, so good gut health means good bacteria in your system are going to impact this as well. Oh, see, acne is a multiple day conference within itself, and I'm trying to do a bit of a gagar mein sagar thing here, so you might find my talk a bit scattered, but please bear with me. The meat of my talk is at the very end. This is a bit of a schema, you're going to find it everywhere, and history, yes. So when a child is approaching you, I doubt if a child is going to approach you for acne. Okay, the child might be with you for a URI, for dengue, for whatever else, maybe a well visit, maybe a cervical cancer vaccine, whatever they would be here for. But then, where do you as a pediatrician come in? 2-3 scenarios. Number one being the acne is significant enough. So you yourself are highlighting that, bhai, iska kuch karna chahiye. You better see somebody. Secondly, they are on the verge of seeing somebody, but they are doing all influencer-led practices rather than doing something scientific. Okay? And thirdly, the child really wants to see a doctor. Okay, but the parents are like, no, this is going to go away. We'll circle back to this when we talk about why to treat acne at all. In any case, history is important. If it is pre-adolescent acne, we've got to think of precocious puberty, family history, diet and sleep. We are going to talk about this over and over and over again because there is such a normalization of bad dietary practices out there. The mother, the father, they're themselves into Swiggy and Zomato. What do we expect the child to do? Okay, the normalization, હું તો જલ્દી સૂઈ જાઉં છું. When are they sleeping? They're sleeping at midnight. They call it early. Okay, that's messing up with their circadian rhythm. In any case, menstrual history is important. PCO is rampant. There are gynecologists who actually say that it's rare to find a child without PCO. Okay, whether or not we are seeing the full-on manifest symptoms in all of them. Though there are children with clear-cut signs of hyperandrogenism too out there. Drug history is important. Now everybody is really protein-focused these days. Okay, and that protein can be whey protein. And whey is a documented, increased dairy in general, and whey protein in specific is a documented cause of increase in seborrhea. Okay? Vitamin B12 is amongst the most common causes of sudden increase in acne, and there is a slew of other drugs out there. And the last point is all the more important post-COVID. Now, this very talk I had taken in 2017 with very similar slides. But at that point, this last application of topicals on their own, it was not that common. Okay, and post-COVID, everybody is an influencer. They get so much of information from behind their screens. See, you don't have liver-kidney influencers. You have skin influencers. They have real-life influencers. They have, a preconceived notions about skin, and they may or may not be productive. Now, quickly going through clinical features. Acne का clinical feature क्या है? Acne जैसा दिखता है. It happens on the face, not only on the face. It even happens on the body. And I've not talked about hidradenitis suppurativa over here, but if you are seeing somebody who's suffering from recurrent major inflammation in the flexures, please ask them to seek proper medical advice and not run around with homeopaths. The types of lesions may be non-inflammatory or inflammatory. Non-inflammatory is usually the comedones, and hence comes the classification. The treatment is driven by the classification, and hence the classification. So grade 1 is non-inflammatory, so just open and close comedones, which is your blackheads and whiteheads, gradually progressing all the way down to severe and generalized acne. So a few pictures. Yeah, skin doctor is here with skin pictures. So I wish I could have a pointer if possible. Okay, right. So what you're seeing on the nose here, it's a very common look beyond the ages of 8 and 9, often earlier. So this is what we call dyssebasia, or increased, oil gland activity. You'll see, I hope it's visible though, but then there are what they are concerned about, open pores. Everybody has pores. The Snapchat generation believes everybody else other than them has matte and poreless skin. Nothing could be farther from the truth. Yeah, so this is the most mild variants of acne. You're seeing something on the forehead. Right, and here the scalp also matters. So we'll circle back to this when we talk about dandruff. Okay, so here we see that the inflammation is finally increasing. This is what we call established grade 2 acne. So there are these papules, inflammatory papules, there are pustules, and this is what we call a background of PIE, post-inflammatory erythema. And this matters such a lot to children. Unke liye, acne is as bad as the blemish as leaves, and they're very, very concerned about the scarring that's eventually going to leave. The parent is like, "Arey, ye to sahi ho jayega." Right? We need to strike a balance. And see, the need to strike a balance, sorry, I'm venturing out slightly here, but see, this entire generation, on one hand, there is this terrible lifestyle. On the other hand, there is a need for looking perfect all the time. There are lovely Gen Z, Gen Alpha words for this. Looks maxing. Okay, you want to look your best all the time. Now, these are two fundamentally contradictory propositions, right? Anyway, circling back here, now you'll observe some increased hair. So this is a child with PCO. Okay, here we see finally the inflammation is increasing. There is PIH, post-inflammatory hyperpigmentation. And now we see more of pus, which now progresses to nodulocysts. Now, nodulocysts are what we call grade 3 and 4 acne. Now, these are not real cysts. A real cyst is what you see on the left. It's a sebaceous cyst. These kids are also more prone to sebaceous cysts. In any case, this is going to scar significantly if left unaddressed. And this is slightly short of acne fulminans. Acne fulminans could be way worse than this. And now body acne, it's common. Navratri IV, everybody wants to get a back wax done. Okay, they're going to end up with it. Okay, and there's dandruff, there's fungal acne. It's all going to look fairly similar. Acne corporis, these are the milder variants, and this is mighty painful. Okay, it can be way more disfiguring than what we are seeing here, and these marks can often take a pretty long time to go. So why to treat acne at all? So all of you had acne. How many of you seek the treatment for acne as adolescents? As adolescents, when you were not yourself financing your treatment? Yes. Okay, so that's a minority. Correct? So here we want to drive home the point and ask them to seek a balance के भाई perfection को नहीं chase करना है. Pendulum का एक end क्या है? I've got 0 dash to give about my skin. मेरे को नहीं फर्क पड़ता वैसा एक बच्चा, okay, जिसका parent भी वैसा है जिसको फर्क नहीं पड़ता है. But at one point they swing to the other side. They'll be like कि नहीं यार अब तो मेरे को perfect चाहिए. Both cannot happen and they have to seek help in time. Now these are what the articles say. The scientific evidence says that complications are scarring, psychosocial distress, and in fact they don't feel like showing their face to anyone, which to us might be too much, but for them it might be like, हाँ तो वो join it. Okay, now post acne sequelae, why do we treat? So that's scarring. And scarring means, so nothing that is medical is going to help with the scars. It's going to be procedures. So this is what we call ice pick scars, different variants of scarring here, which my cosmetic colleagues would be better placed to explain to you. Sorry, I'm more of a clinical dermat. And so this is a significantly scarred face out there. Abhi iske saath patient aaya, so they are going to require procedures. Also, we don't want to miss out the association with other diseases. The commonest being PCO. What we don't want to miss out on is the Heron syndrome, SAHA, etc., even SAPHO. This is all theoretical, you will all find it everywhere, and guidelines for management. Now, in the Indian scenario, iska thoda tweaked version chalta hai. Ideally, we should address it's going to be slightly longer. Ideally, we should be addressing the oiliness first. Here we tend to sabhi ko clindamycin mil gaya. There's no prescription restriction in our part of the world. People are merrily applying topicals. But actually how it should go is that we should try and control the oiliness first, gradually moving up the spectrum as they require topical antibacterials or systemic antibiotics or systemic isotretinoin and other treatments. Now, recommendations for antibiotics. Now, I'm going to be very fast here. We cannot rely upon antibiotics as our soul and soul. So there is clindamycin and there are other things. Immunotherapy nahi chalegi because it is going to beget a lot of resistance. There is a lot of primary resistance to clindamycin as of now. Benzoyl peroxide, those children who consume a lot of skincare content, they're very enthusiastic about applying benzoyl peroxide. Parents are also happy because it's a very cheap tube out there. They're very cheap wash-off formulae. But in our scenario, this is dark skin. We are very prone to post-inflammatory hyperpigmentation and we live in a sunny weather. BPO ka prescription is not something that has to be done, apne aap nahi karna hai, only under the guidance of a dermat. BPO helps, yes. Retinoids. Now, retinoids are the cornerstone. These are vitamin A derivatives. The oldest being tretinoin, the newest being triferotene. Okay. And between that, there is adapalene, there's something so strong as tazarotene, and these hold the magic in their hands of managing acne well. But unless and until the entire procedure is explained, this is what the child is going to end up with. Okay, now this is what we call retinoid dermatitis. Puri fat gayi hai chamdi. There's a lot of irritation. Okay, and sun exposure has to be prevented, and there's a longish list here. Other topicals, yes, the internet is crazy about niacinamide. Isme niacinamide hai. Unfortunately, the evidence is fairly low. There are plenty of other things like azelaic acid, salicylic acid, which is a cornerstone. The child is going to come and tell you, I'm using AHA, BHA gels. Okay, everything has its place. But what we talked about earlier is way more important. Systemic antibiotics, we cannot rely upon these things as the whole and soul, again. But in case of the more severe variants, iske bina kaam nahi chalne wala. We prefer the tetracycline group over the macrolide group vastly. And sometimes something more stronger may be needed as well. Isotretinoin is ideally the Brahmastra. Okay. It is the systemic retinoid that has it in its capacity to reduce sebum production if used properly for a prolonged period of time. Abhi this 1 mg per kg isotretinoin in our setup, again, it is going to derange the LFTs, it's going to cause massive dryness. So here's where the art of medicine comes in. Every single dermat has their own protocols, and lower dose isotretinoin also seems to have salutary results. Isme mere ko aapka ye cooperation chahiye ki if the child is taking isotretinoin, please don't vilify isotretinoin. Okay, given under proper guidance with monitoring of LFT, with monitoring of cholesterol, and provided the child is not prone to depression. I take mental health as a big cornerstone here. कि उसको ignore नहीं कर सकते हैं. We have to choose the patient carefully. It's a wonderful drug. They should not be self-treating. अपने यहाँ children also self-treat. They buy. They convince their parents to buy things for them. Thankfully, at least till now, they are not taking hormonal treatment on their own. ये OCP भी ले लिया. But drospirenone and low-dose OCPs have a role here. Aldactone has a role as well, spironolactone. There's a longer list here of physical modalities, right, ranging from intralesional steroid injections to comedone extraction to a lot of lights and lasers and chemical peels that can help with the ongoing acne as well as the sequelae of acne. Anyway, I want you guys to focus on this. The miscellaneous advice, what you can help the child with. Please feel free to click this because this is what you want to, emphasize and re-emphasize. Ke khao sahi. Okay, eat right, eat in time, fix your sleep schedule, and we're going to circle back to this when we talk about skincare advice. Now, something very, very closely related to acne will be dandruff. So, dandruff and sebderm or seborrheic dermatitis is again some very common annoyance of adolescence. Okay, pretty common. You're seeing facial acne, you should always ask for dandruff and body acne. Here, the contribution is by a yeast fungus called Malassezia furfur, and there can be scaling not just on the scalp, but also on nasolabial folds. This is fairly common. Kindly observe this area. And if you're seeing something here, then you should always ask. Oftentimes, they take dandruff very casually. It can descend to the lids, and there can be frequent styes. There can be seborrheic blepharitis as well. Often, there's an overlap with atopic dermatitis, but that is beyond the scope of this particular talk. The treatment, I'd like to highlight here that ketoconazole shampoo deke kaam khatam nahi ho jata. Okay, that is just one of the things, and against that too, the resistance is increasing. We have to emphasize, hygiene part, how often to shampoo. A rule of thumb that I follow in my practice: all males daily shampoo, all females shampoo once in 2 to 3 days, and girls shampoo once in a week. Sunday to Sunday, so you're going to end up with build-up. Boys, what they do is they put hair, water in their hair each day. So that makes the water-soluble things go away, but the fat-soluble dirt keeps accumulating, and that adds fuel to the fire of dandruff. Oral antifungals may be needed in a good number of these patients from time to time. Now a few quick pictures. So what do you think? Is this dandruff? Something related. This is pityriasis versicolor. I'm going to be pretty fast, sorry. This looks like acne, but this 17-year-old decided that he had scanty beard, applied a beard growth oil, and ended up with what we call acne cosmetica. The parent thought for the longest time that garmi hai, pimples hai. Those were not pimples, they were molluscum. And the one on the right, I thought that it was early acne. Few months down the line, it turned out to be plain warts. Right, so a lot of things can be similar. Another thing that kids may approach you or may be concerned about, is striae. They are a part of growing up. Often they have these growth spurts. Their external skin is not really able to keep up with the internal growth. They're very embarrassed, they're very conscious that this is a common area, as is the lower back, these tiger stripes. We've got to really counsel. This is something everybody has. Okay, moisturize. If you're really conscious about it, once full physical growth is there, there are physical modalities, cosmetic modalities, procedural things to help you with this. Topical retinoid may also help, but as a primary treatment, moisturize and accept it. If you see patches of hair loss like this, kindly ask them to not ignore it and see a dermatologist at the earliest. Quite likely, this can be alopecia areata. Rarely, it can be tinea capitis. And not so rare is habit tics, trichotillomania, twirling. These people that can masquerade. And this is where we strongly need to support of a psychiatrist as well. Children, they keep wearing the same sort of jeans again and again. They're very embarrassed to accept, the older children. Okay, and then when the parent comes to know, they self-medicate with creams. What do you think this is? Tinea. You ask one dermat, we are so keen to talk about the tinea epidemic that is there out there. Okay, and that is all fueled by your Zolef. Okay, parents take topical steroids very, very casually. Okay, there is barely any education out there in the general public about what power a tube of steroid holds. In any case, they're going to end up more in trouble. This talk isn't about tinea. We're going to progress. This too is one of the neglected tinea cases. Now, sorry, I'm going to take a few minutes more. A common adolescent concern. Ladkiyon ki, sorry. I'm so sorry. I'm going to be fast. I'm going to need 4 to 5 minutes. I'm sorry. Okay, so oftentimes mothers ask, which is the best way to deal with body hair? Okay, so there's no single best way out there. Hamari generation mein waxing kiya does not make waxing the best. India has cheap labor, which is why waxing is prevalent. Shaving is what is done all over the world. This I'm talking about girls. Okay. there's no single best method. I'd like to emphasize that there is the entire slew of promotions from Meri Jamaat, and quacks who are into cosmetology. These are laser hair clinics. Your hair is going to go away. The hair is not going to go away. Okay, it's laser hair reduction. It is not laser hair removal. Okay, so diode lasers and your Q6 NDA, it's going to help you reduce the density over a period of time. Okay, provided it's done properly. Now the key point here is the youngest child who can undergo LHR 2 to 3 years after menarche. This is what the cosmetic side guidelines say. Dealing with body odor, oftentimes they're very embarrassed to accept. Okay, or दूसरी तरफ there is misinformation that antiperspirants, aluminum compounds, they cause cancer. They're very concerned about everything causing cancer. Okay, the internet has told them sunscreen is going to cause cancer. Okay, their antiperspirant is going to cause cancer. We got to we got to separate fact from fiction here. Okay, there's no definitive proof that parabens are going to screw them up for life or any such thing. In any case, antiperspirants are the way out. Proper hygiene, washing frequently is the way out. Now this is the very end, and there is a few slides about skincare tips for adolescents. Please feel free to take pictures and convey these to your parents in case they do ask ke bacche ko batao ke kya kare. Diet is the key. It's the key that holds everything together. We tell the kids that garbage in, garbage out. Galat dala, galat jawab. Okay, junk, oily, processed, packaged, sugary, cheesy food, kids survive on Nutella. Okay, they feel that the Starbucks loaded, whipped cream loaded coffee is the thing, but no, it's going to mess up the system beyond compare. And equally important is sleep. Okay, they say कि मैं तो 6 घंटे सो गया, but that 6 घंटे is happening from 3 a.m. to 9 a.m. Okay, so that's not such a brilliant idea, because when you're messing with the circadian rhythm, you are going to end up with disturbances. There are so many kids, we didn't talk about prolactin, but hyperprolactinemia is rampant. You get reports done of a child having resistant acne. That can be one of the reasons. Oftentimes they neglect drinking water in favor of caffeine. So we got to say that pani hai, everything else is everything else. How to cleanse. This is applicable to all of us, not just a teenager. Avoiding, very long showers, avoiding bathing with very hot water. They tend to keep washing their face too often. बार धोते रहते हैं, thinking that that is going to help them with their oiliness. Actually, it's counterproductive. The more you wash, the more oily often it becomes. So washing 2 to 3 times a day is much more than enough. Physical exfoliation and scrubbing may not be the best idea. They feel that my skin is oily, why should I moisturize? But there is a moisturizer for everybody. Protection, here there are teen moms who come and tell you that ये बहुत tan हो गई है. Why does she play outside? No, she's going to go to swim, prescribe a sunscreen. There are wonderful sunscreens and or they are available in my pharmacy. Why would I mind advising? Okay, but the point is that no sunscreen can prevent tanning, because sunscreens prevent damage. Tanning is not damage. Tanning is the inbuilt bodily umbrella that your body is producing whenever you get exposed to the sun to protect you from further risks of skin cancer. Okay, so the best of the sunscreens applied properly is never going to rival covering that area up. It's a whole talk within itself, sunscreens, and then, yes, they really feel that home remedies kar diya, aloe vera laga liya, something mild that YouTube and WhatsApp have told them. That should never be encouraged, because no home remedy is 100% safe. They should stick around with good products, recommended products, which are less likely to mess their skin up. And makeup ka kitna bhi manai karo, like the skit told us, mirror, mirror, they are going to use makeup. Okay. What I emphasize is that use it as less often as you can and remove it properly. Okay, never sleep with your makeup on. Now for boys, while shaving, we advise to use a sharp razor, ulta shave nahi karna hai, use a sensitive skin ke liye bana shaving foam and things like that, and not to share razors, obviously. And at the heart of it, avoid touching the face, popping pimples, keep the hair off the face. They move around like this, they come in your OPD like this. This is what they look like, and then this is all coming here, right? Mummy to yahi bolti hai unki, hum bhi bole to shayad wo sunenge. And finally, couple of slides about hair care. Yeah, so I'll talk about the last slide first. The permanent question, ke tel nahi dalta ye. Is oiling essential? No, it is not. Right? But then oil is a basic pre-wash conditioner. Way back when there were not many gentle products out there, oiling was maybe a good idea. But yeah, so it's a perfectly optional, especially if बहुत ज़्यादा तेल डाल दिया तो they're going to end up with more of occlusion folliculitis on the foreheads, etc. Shampooing, we discussed, it should be happening more frequently. Now comes the question of which shampoo to use. If the shampoo is being used every day, yes, a milder sulfate-free shampoo. But I see a lot of girls who are as such shampooing once in 3-4 days, once a week, using a sulfate-free shampoo. We live in a place with very hard water. वो clean ही नहीं करा आपके बाल. Okay, and you end up with more built up. So it's not that simple an equation. And the final point, yes, we ask them to manipulate the hair as little as possible. They want to use dryers, they want to get semi-permanent, permanent dyes, the blue, green things. A lot of them are very, very keen. और फिर चाहिए better hair quality. We have to emphasize that virgin hair is happy hair. The more you mess with it, the more you're going to get into trouble. And the maintenance of a BMW is way more than the maintenance of an Alto car. Okay, so this is your native hair. It's not going to require any maintenance. It's not even colored. Okay, so be it. So we adults understand. The children require certain, ways to make them understand. Anyway, thank you very much for listening to my scattered thoughts about what adolescents can be helped with. Thank you so much.